Let's go ahead and do introductions first. We're here for the Health Policy Committee meeting.
Felix Rivera.
Austin Quinn Davidson.
Suzanne LaFratte.
Forrest Dunbar.
Natasha Pineda.
Christy Bishop. Christy Lawton.
Thanks for coming today. Today we're going to start with an HD update. Natasha will give us. Oh, looks like we have someone on the line. Are you walking up the stairs, Littleton?
Who's on the line? Oh.
He said he wasn't going to come.
But he came and got us.
Okay, well, mystery person's on the line. Natasha, do you want to go ahead and give us your update?
Yeah, so I am not actually going to do an official update this month just because it's only been 2 weeks. And so what we'll start doing since the last update. So in the January meeting, we'll have an update on our November data. That's kind of how it will run. So that way, also the benefit of that is going to be that I'll have enough time to actually get it edited and put together in such a way that I could actually give it to you, which would be nice. So starting in January, I'll do that. I did want to, though, before we get started, since we were going to be having this presentation and discussion, wanted to just cover the 3 questions that we understood you wanted to talk about, 2 of which I think Christy is suited to address, and then the other one being related to the request for forming of a multi-agency public health team to focus, I believe, the Midtown Community Council. I believe that's what you meant, Felix, is their reference on page 7 of their letter to establish a multi-agency team with the CDC and state to monitor and address the growing public health threat related to contamination of natural waters in Anchorage, right? So I just wanted to review some of the points that I brought to this body in August related to the question, because we really have gotten this question multiple times, whether it was through Midtown Community Council or from another party and an interested researcher who has brought this issue to our Health Commission a couple of times. So I just wanted to remind you guys that, well, first I wanted to correct something that was incorrect. So on page 8 of their report, they do a caution that says there's 2 cases of typhoid fever, that nobody knows the source, and that we should be very worried about this issue. So I wanted to talk a little bit about the actual rates of infectious disease and the source of those 2 cases. And I did just talk to the section of epidemiology at the state to make sure none of this has changed since we last spoke, and none of it has changed since we last spoke. So we've never had plague or typhus in Anchorage.
Oh, good.
Yeah, it's good to know, right? No plague yet. So we're excited about that. In 2018, there were 2. Hey.
Climate change.
Climate change. Yeah. You never know. At this
Actually,
point.
you know, what's going to happen would be unusual and unique, not seen for 10,000 years.
Yeah, we have no idea.
Bacteriological and viral problems.
So we have no idea what it's going to be. It could be, I could have it right now. In 2018, there were 2 people that reported typhoid fever in Anchorage. One became sick after traveling to Burma, and others developed the illness while traveling in America Samoa. And really that makes sense because oftentimes in certain countries, not the United States, you typically have more people that are carriers of those pathogens, and so it is much more common to get them when you're traveling abroad than you would ever have them from using the water here in Anchorage.
Can I ask a question, Natasha?
Yeah.
Is that because they're not vaccinated for those?
You know, I talked to, there are, I mean, we could at some point, if you guys want to know, we could have an actual physician or like an epidemiologist answer that question, but generally, yes, like the burden is higher in other countries in people's bodies than it is here. So she gave me this great quote. It's rare that people are pooping or shedding active pathogens, especially in Anchorage. Like that's not, you're not going to be having a lot of carriers of these diseases. So while you may have like high levels of human waste in areas, it's most likely not like carrying a pathogen that would be of concern. It does happen but it is more rare than, say, in a third world country where they have much higher carriers of cholera and all those other kinds of diseases that are spread through water. Tuberculosis is our bigger ongoing challenge in Anchorage and elsewhere in Alaska, and has been for a long time. We see very rare cases of hepatitis A in unvaccinated persons returning from out-of-country travel. Many people in Anchorage and elsewhere have unrecognized hepatitis C infection. Most can be cured with new treatment regimens, and that is not passed through fecal-coliform contact. And so I have lots of details on all of these different diseases. I think I've emailed some of them to some of you. I'm happy to send more detail. But when I talk to our team, which Christy leads, their biggest interest is continuing to find and treat and cure people with active TB or latent TB, to continue to work to get Hep A vaccinations out and available in the community, which is preventative in nature, and to make testing for Hep C more widely available. Those are the things that we really think we should be focusing on. And to address the question from the council about forming a multi-agency public health team, we already have that. So when any time there is any kind of disease clustering, outbreak, whatever it may be, we work with the section of epidemiology at the state and the Arctic Investigations and the CDC, depending on what that is. So, for example, the recent Rogers Park sicknesses, our nurse was out there collecting samples, working and calling daily with the state, and if it had turned into something that was more complex, the CDC would have gotten involved. So that's how we do it. We do form teams, and we respond, and we monitor, and we're always monitoring disease burden in the city. And there is, as we mentioned at the last meeting, that work group that's working with shelters and soup kitchens to make sure that with that most vulnerable population, that we're making, vaccinations available, that we're monitoring the levels of illness in that population. And so we feel that we already addressed that monitoring request, just on the public health side of disease monitoring. And that's kind of all I have, but if you guys ever need more details, I'm always happy to share with you.
Great, thanks. Yeah, Ms. Brent. Thank you. So how many staff, Natasha, do you have that are focused on disease prevention or response and working on CDC?
So we have, do you want to answer that question, Christy?
Sure. We have about 38 staff in our community health nursing program at large, and I think about 13 of them are working kind of in the disease prevention, tuberculosis case management, with varying roles in terms of public health nurses as well as support staff and nursing assistants. So it's a small team, but they do a lot.
Sorry about that, but a primary function of the department.
Yeah, I mean, that's a primary function of their job. Dr. Chandler works primarily in that work unit, and has been outside of immunization and child health. His big focus is tuberculosis, Hep A, Hep C, and working with those nurses. And there's actually, is there 4 nurses?
I think there's 5 or 6
5 or
nurses.
6 nurses,
Yes.
and then a couple of support staff. And yeah, that's what they do every day.
Mhm.
Great, thanks.
Great. Yeah, Mr. Rivera.
Thank you, Madam Chair. So, a couple things. First, I just want to provide a quick frame and then go on to specific questions on that one. There was, I think, sort of a big impetus to having this discussion here was a fecal count report that came out in February. I think it was specific to Chester Creek, but I don't remember it exactly. It's been a long time. And every month since February, multiple of my community councils and maybe Mr. Constant's councils have asked me to address this issue and understand how the municipality has addressed this issue. And I understand from your comments that this has been, even before February, people have been asking about this. So I want to thank the co-chairs, the health department, and on-site for assisting with this and for making the time today to do it. So in late summer and through the fall, the Midtown Community Council worked on these resolutions. And they pointed out some issues and some suggestions. And so I just want to be clear, so from your response on I have two of them. This is the second one. So the suggestions in the community council's resolution first is to create the multi-agency team. And so from your response, we already have it.
Mhm.
Now, you use the word monitoring. Does the multi-agency team do any work on prevention?
Well, yeah, by doing vaccination clinics and ensuring the population's vaccinated that is at highest risk. They're working right now with the state to get Hep A on the Hep A vaccination on the, oh my goodness, I'm forgetting the name of it. It's backtrack, basically that it would be low cost, no cost. And it's already, I think, completely free if you're homeless, so yes.
Okay, thank you. Then the second thing is, under public health, they had a few different solution ideas. One of them was increased access to public restrooms. In your opinion, would such increased access reduce public health concerns?
I don't necessarily think it will reduce public health concerns, but I have heard that, I mean, and this is just my personal opinion, I haven't studied it like as to answer a scientific question, but certainly public bathrooming has been a question since I first started. I think I've talked with all of you about it. People always ask us about it. We don't have anything to do with maintaining or operating public facilities. However, it's probably a good thing to have bathrooms. There are lots of cases or information where people might still have access to a bathroom, but that doesn't mean they're going to choose to use it. So, I don't know the answer. I can't tell you conclusively that I think just because we have bathrooms, we're going to stop having people use waste on the cities. There are other cities that have public bathrooms and they still have waste on their streets. So I don't know the answer conclusively.
Yeah, Mr. Hill.
Thank you.
Thank you. I guess I would say to that, we've had this conversation before too. To me, it's more about the cost of the public bathrooms, which seems to be surprisingly high in a lot of cases if we want to build a facility that lasts.
Right,
I
and
will
it has to
say,
be hand washing.
right. I will say that, I know what you're getting at when it comes to some other cities that have installed public bathrooms and folks don't use them. I do feel like that we are fairly unique in that we have I think we have a fairly unique population that lives in our parks. And in my experience, for example, when we put in the new park at Muldoon and DeBar, and then eventually they put two porta potties there that were covered by a wooden fence, and they have gotten heavy use from folk, and I believe, and most people, anecdotally it seems, from people that were living in the park, right, that it abuts. The biggest problem, of course, is that they routinely destroy the porta potties.
Right.
And so, yeah, I mean, I do think that people would use them. I think that the challenges lay elsewhere in how do we maintain them and how do we keep them safe.
And I don't think their question, like, it's not something that actually the health department can address or even has any expertise on at all, but certainly is something we've heard about, is interested in, and as a mom and a person who lives here, I'm really interested in public bathrooms being available, but I'm also not the right person to speak to it.
Mr. Constant?
Yeah, I think there was a different question. The question was, would bathrooms reduce the, presence of people called in our creeks? And that's a question.
Maybe.
It's hard to answer.
But
interestingly, on Friday at our work session, I'll be presenting some information from NLC about a not $500,000 public restroom that can be implemented, basically like $130,000 to $150,000 for a really solid unit that can be hosed down on the inside, has hand washing, is heated. Yeah, so I will be bringing that information forward, but I think, again, it's a separate question about the contamination. I think the question before, will that help, is have we determined what the sources of those contaminants were? That's the real question.
Chrissy can talk about that. She has some more information about that and is able to speak about the report and is the expert to discuss it. But personally, our leadership team went walking about Chester Creek recently with the intent of, I had a personal intention of trying to figure out where they were bathrooming and where it was being stored. We go out every once in a while, but I never actually looked for it. And most of those camps have a separate bathrooming area that they've blocked off where they go use it. And there's obviously a desire not to defecate in their own living areas. And so I agree that there is probably would be use of any bathrooms made available, but
And
that's all I
only
can
one
offer.
time in all my years have I seen an actual latrine set up to drop waste into the creek.
Oh,
And that was on my.
I've never seen it,
my
yeah.
boat tour. No,
Most-
my
yeah.
boat tour with
Campbell.
Jeff
Campbell
Landale
Lake,
and
no, just
Campbell
kidding.
Creek.
Yeah.
There was one, you came around this perfect, beautiful corner, they have their tent set up, and right off the cliff, their toilet paper was on a branch
Oh,
over the
wow.
water. And so, but that's once in
Right,
15
because
years.
we walk about, and I mean, I
Yeah.
always find them, and they're usually blocked off, and they have cardboard around them, and when they're done, I mean, I'm not saying that that's not contributing. There's somebody else that can answer that question, but I don't. I think they're like all of us humans and understand about keeping things clean and separate from their living areas.
Mr. Rivera,
I mean, there are some real dead
Sure.
places that decay really quickly, and that's another side of it. And they're very limited.
So Mr. Rivera had a question or comment, and then maybe we're kind of leading into item 3B, but then maybe Christy could give the presentation to us, and we can see if there are any follow-up questions.
Great. Yeah, thank you, Madam Chair. So final comments, and then yes, I am very interested in hearing the response to the fecal count report and sort of what the analysis of that. So the Midtown Community Council, I think one of the solutions that has been proposed and we've had public dialogue on, especially when it regards to public restrooms, is the idea of day shelter in Midtown. And the Midtown Community Council is really supportive of it, and I think part of the reason why is because of this public health concern. So just wanted to note that on the record.
Thank you. Christy, you ready?
Okay.
Do you have any data?
Yes, please. And if this doesn't pull together, we can do it without the computer.
Thank you.
Lights turned off, you can just see your.
It's like,
So I printed them in large slide form because some of this stuff is so tiny. If you ever did want to refer to it, you would need this size rather than note size. How do I get this? I just want to enlarge it. Oh, it is large up there.
Yeah.
Duh. Okay, so I thought I'd take just 1 minute and tell you why I think it's worth me talking to you. I started at the health department 26 years ago, and I was hired to collect fecal coliform.
Wow.
So, so it's kind of funny to be here
What a-
today.
Yeah, what a journey.
I'm moving on to page 2. There was a crisis back in the 1980s. I don't know if any of you would remember it, but there was.
Felix wasn't alive, so.
They discovered.
We were born in the 80s.
God, I feel old.
We all do, and we're not even old compared to Felix.
There was
Okay,
a
go ahead.
shocking discovery that
Hold it
fecal
together.
coliform was in the creeks. Our water bodies have fecal coliform. Oh my gosh. So there was a task force put together. It was led in the health department by what was then the water quality section, and that was disbanded over 20 years ago now. So they canceled the Campbell Creek Classic, which was a boat race down Campbell Creek, and they bonded funds to study fecal coliform.
wait a minute. Bonded for a study.
They put it out to the voters.
We're getting ideas.
Yeah.
I'm just trying to understand the mechanics. We'll
Usually,
talk later.
usually we can't bond for things
It
like
really
that, but
happened. It really, I know.
Hear that?
It's like, it really happened.
Natasha.
We'll get her talking to bond counsel.
Yeah. I don't know if it could happen
Don't get in
today.
trouble, though.
There would have to be,
Move on.
that's right.
All right, it's a distraction.
Okay.
I told you they're really distracted.
Well,
Treasure prepper.
This is kind of interesting history, don't you think?
We
It
have to
is,
be
I didn't
really
know this.
serious in almost all other settings, so we
Yeah.
really, we let it all out, you know.
When we're talking about.
Yeah.
So they began monitoring, lots and lots of monitoring. And they looked at fecal coliform levels in the creek, and they also looked at fecal coliform sources. And that little picture I put there to represent this is kind of how they parsed it out. They were looking at, identified potential bacteria pollution sources. And at the time, of course, there wasn't any DNA studying available, so they kind of went out and looked at where the sources, where the levels were high and what the potential causes were. So, next page. It was an unintended consequence, but one of the things that happened out of all of that monitoring is EPA came in and gathered all of the data from the health department and took it away and listed all Anchorage water bodies as impaired for fecal coliform through the 303D list of the Clean Water Act. And the DEC was then tasked with creating load allocations, total maximum daily loads for each source, all contributors, what they're allowed to contribute to the creek in the way of fecal coliform. And you can probably guess what that number was. Anybody? 0, that's right. All of our waters are identified as drinking water sources, and 0 is the allowed bacteria in the drinking water. So,
Donna, excuse me, Donna, if you want to hand out, I think there are.
okay, I'll get you a note.
Sorry, Christy, go ahead.
Yep. So TMDLs are in place, and nationally it was decided that MS4 permits, stormwater permits, were to be the manager of TMDLs. So it went.
Total maximum daily load, like the amount of, well, go ahead.
Yeah, the allocation that was allowed into our waters in the way of bacteria. So now the MS4 permit, APDES, is the keeper of these fecal coliform assignments, and that's how I still come to be talking to you today, because I oversee the APDES permit for the city. So next page, which is page 4, Donna. Watershed Management Services, who oversees the permit for discharge and is in project management and engineering, rounded up the studies, all the studies, and summarized them. And this is kind of a glance at what we learned and what the data looked like. There's 4 years of data in that graph, and it kind of shows some relative numbers over time. And these are from the 80s and 90s. And we looked at it with regard to temperature, and we looked at it with regard to where the samples were taken, et cetera, et cetera. We learned that fecal coliform levels certainly increase with runoff. The sources of fecal coliform are both domestic and wild. Changes in numbers, they go up with increased density. And we also learned that fecal coliform adsorbs onto sediment. So sediment grabs it, sediment sinks to the bottom of a lake, it pulls the fecal coliform down with it, and it sits there. So, I don't know if anybody's even looking at this. I forgot to put advancing. So that brings us to the recent study that you asked about, Felix, the Evaluate Fecal Coliform Bacteria for 2 Anchorage watersheds, done by Anchorage Waterways Council in 2019. Consistent with past results, high variability, numbers in the upper watershed sometimes exceeded state water quality standards, and that means that above Anchorage, there's fecal coliform bacteria in the creeks before it gets into our area.
Hmm.
Is that from wildlife?
Yeah. Yep. Exactly. So sometimes, before the water even gets to Anchorage, the numbers exceed state standards. That's probably important to remember.
Yeah, Mr. Beckman?
There's a really basic question that you might have answered, and I just didn't hear it. Fecal coliform, is that what growing up we call beaver fever? I mean, is that Giardia, or is that something else specifically?
Giardia is its own thing.
Okay. So
But
what is fecal coliform?
What is
exactly?
that's a good question. Okay, fecal coliform is the indicator the state chose for fecal contamination in waterways.
So it's not like E. coli or Giardia. It's not a specific disease. It's just the presence of fecal matter. But fecal matter is highly variable, right? So, like, for example, moose poop is a lot less toxic than human poop,
Right.
right?
Mm-hmm.
Does fecal coliform capture that?
Mm-hmm.
Oh, it does. So,
Well, it doesn't-
no, I'm sorry.
It doesn't differentiate.
That's what I'm saying. So, it's
Yeah,
interesting.
so how useful is the
Yeah, is it as a
measurement?
measure?
Well, and I'm sure she'll get there, but the conversation of is it dog at Campbell Lake, is it people, is it moose? That is kind of one of the rubs of all of this, is figuring out how to determine that. I'm sure that's part of this talk.
And it's all of the above.
Yeah.
And
Huh.
so,
To me, that seems like a much less useful measurement than I thought.
it is a much less useful measurement.
And is there no way to do a more useful measurement that actually tests for the type of?
The state is starting to use E. coli, but the official number the official indicator is still fecal coliform, and it has been all these years.
Yeah.
But isn't it, what's important there is that secondary step, identify a hotspot, and then you actively go look for point of source contamination, then you can make the determination, well, this is a wildlife area north of Anchorage or in the mountains, clearly there's no human settlements, this is wildlife. That's where you get to the factual basis, even though that's not hard science, because it's based on investigation.
Oh, it would be, I mean,
Yeah, you're
if the
taking
study were
additional
done
tests.
properly.
You're right, if you
Yeah.
did it broadly enough, but in the cases we're talking about here, it's, what's the word, versus, instead of a study that's done on lots of numbers, it's just a study.
Like a small sample
Yes.
size?
Yeah.
But I don't think it's a sample size thing, right, because it's additional testing specific to that stuff. Like
It doesn't
maybe
have
then you
to
would
be.
test where it's from, or?
It doesn't have to be. A focused, good study can be done on a very small area.
Yeah.
And that's what watershed management is about these days. We're not interested, we feel pretty confident that there's fecal coliform out there. And we're pretty darn confident that it's from all sources. And I'm jumping ahead of myself a little bit, but.
Well, maybe we can let you keep going and
Yep.
then.
Okay. Oh, by the way, these studies that like Anchorage Waterways Council are doing, they've been funded by the DEC in oversight of the TMDLs I told you about. So the state gave us the TMDLs, and then they pay they put out different grants to people to go out and see if there's any difference in the waterways. The numbers today are pretty consistent with the numbers 20, 30 years ago.
Has that money been going down, that the state allocates to do this sort of testing?
I think the state didn't give out that money this year, which is, I think, the reason you are
Sounds about
being,
right.
asked for money.
What were we asking?
I didn't
That's the
realize that.
ultimate goal, yes.
Oh.
There's a group, the Anchorage Waterways Council is trying to get money to do a deeper dive.
We should ask the state.
Yeah. Session starts in January. We'll let
And-
them know.
We just did our budget.
And by the way, the Anchorage Waterways Council is who I paid to do my public education for fecal coliform. Okay,
For the assumption that it would go to the state, I think there is this conversation that's kind of emerging about there could be a better way to do this analysis. If there is at some point a value that we determine there is, rather than taking their proposal, which might be for their political goals, we
Right,
can
it's like
look at.
giving the watershed, and the thing for me, I'm sorry, we're going off subject, is that they're coming to the health department and the health commission, and I have asked them multiple times, like, watershed management is doing this work, is experts in this work, and they should be the subject matter experts and the group that's being resourced to do it.
You're
not-
saying community groups are
It's
coming to you
political.
guys, or who's
Yeah,
coming to you?
the Waterways the Council
Yeah.
and Dr. David Morgan and the Rogers Park Community Council and others, and I've recommended them multiple times to, that's not our function anymore. It was a long time ago, but it is not any longer.
But I think my point there was that don't discount that maybe we do have an interest in sometime in the
Yeah.
future of doing an investigation, but it should be predicated on
Our
good
expert.
scientific modeling and what we really want to achieve, not just the political push from a loud community group.
And we have, a long-time municipal experts that are already working on the issue. So that's my only dog in the fight.
So I'll move us on to page 6. We looked, the previous study, we looked a lot at the numbers and summarized them. And then we started looking at, well, okay, where's it coming from? So we did this transport model and found that, it comes from all over the city. It comes through our pipes into the receiving systems, which are the creeks.
Can you kind of walk us through this model, just so
sure.
we can get oriented?
Sure. The bottom line is the creek itself. It's stream sediment fecal coliform. So that's looking at the sediments that are in the creek and figuring out, okay, here's where the sediments are settling, grabbing the fecal coliform and just holding on to it. And then the number, or the line up above it has to do with runoff. The actual, it's in the water column itself. And that's where we see the peaks of fecal coliform. And the report that you saw for 2019 is a water column report. And so it kind of showed these peaks with regard to where they sampled fecal coliform. So you start in the winter, and you've got street melt during little breakups, and then in the spring you get all the spring melt runoff from the yards and the streets, etc. Then you move on, you get your alpine melt from the high mountains. And as it comes down, it resuspends the sediment that is sunk in the lakes, etc. And then we see our peaks through the summer season. And during the rainstorms, etc., we see runoff from our yards coming down through the pipes, etc., and contributing to that. And then as you move into winter, it all settles down again. So you can imagine, let's just talk about it for a minute. Where would the homeless camp poop fit into this model? Thoughts?
From the spring melt until freeze up. Even though it's collecting in the winter.
Yep, the camps that are off the creek, like just in little holes here and there, they might be contributing through the pipes, but might not. It might just be contained there on site. Now the camps that are lining the creeks themselves, they're not coming through the pipes, are they? They're overland moving into the creeks. So that would be a different arrow on this model. We'd have to add that in. So it's not entirely represented here.
Even if I might, Chair, the Campbell Creek trip that I took, that I already referenced, it was interesting. There's only one bend on the whole creek that's smelled. It's disgusting. And it was only 50 feet wide, which clearly to me was, there is a presence of a broken sewer pipe here. Like, that to me was crystal clear. That if there was high levels, it was coming from that point because it was gross.
Okay. Well, that's something that we could go out and investigate. And if it were a broken sewer pipe, I'd probably get AWU involved. But if it were an on-site system, I would get on-site involved. So those are all potential. So, and you bring up a good point. There was a restaurant down on 9th and Gamble a few years ago who they were starting up and the plumber came in and hooked up their sanitary sewer to the storm drain.
Oh,
How did we figure that out? Well, our street maintenance guys clean these things every year. They open up the lid, they see toilet paper, and they're like, duh. So they know. They know when these things
Ms.
happen.
LaFrance had a quick question or comment?
Thank you. On the settling part and how it gets churned up and then settles again, over time, does it disintegrate or, does it would sound like it would build up over time? And
It
that's
also
not the
breaks
case.
down.
So it just
Yeah,
breaks
so
down.
it builds up, it
Same
breaks
time.
down, it just takes time, and of course, the amount of the source and the newness of it, et cetera, go into that. It's just, I've never been able to get a linear, probably doesn't mean anything to you, but I mean a straight cause effect. Like, I should expect the fecal coliform to be this on this day, and this on this day, and this on this day. Doesn't work that way because of all of these other things going on in the creek. There's just no, I couldn't predict the number today because of all of those extra things going on.
Which makes it really hard to pinpoint the involvement of homeless camps because there's all these other factors and types of poop and all kinds of things going on.
That's true. But reasonably sitting here, we can all agree that the homeless camps have an impact. I mean, they're having some contribution to the receiving system. There's no doubt in my mind.
Has there been any testing done around some of the homeless camps to see what type of fecal coliform is showing up, like kind of the next level?
Not in the way that you're asking. Now, we do, every year we do dry weather screening and we do wet weather screening as part of our permit compliance. And our sites kind of bracket some of the homeless camps periodically. So we get, by virtue of the fact that our regular sampling sites are near them, we get some impact from them. But we haven't gone to the camps themselves and tried to do a project that was specific to them.
I don't know how far ahead this is, but my strong sense about much of this is that it's a hysteria that's being utilized for political purposes, and it scares me.
Well, you just got to my bottom line, so maybe we'll just jump there. I only had 2 slides left. So, do you guys remember when the AWACS plane went down, the sonar plane that the military runs? Do you remember when it went down?
20 years ago.
Yes. Birds got sucked up into the engine and brought this plane down.
So before I was born.
I participated on the task force that was put together to address that problem. And it's very much like this. It's the military wanted action, and the needed action nobody really wanted to deal with. So they pointed to water quality and said, these birds have an impact on water quality, therefore you should do something about them. What needed to be done? The goose population needed to be cut in half. That's what needed to be done. But nobody wanted to deal with it that way. So there was all this pointing going on, and geez, this must be a water quality problem. It's not a water quality problem, it's a goose population problem. What you just said is exactly the case. Homelessness affects water quality, but it's not about water quality. So let's not let this get deflected in the wrong direction. Let's deal with it as the problem that it is. I'm happy to participate. If studies truly need done, I'm happy to make them happen. They would be attached to studies we've already got going. But I wouldn't recommend going out or letting this turn into a water quality issue.
Yes, Mrs. Rice.
Thank you. Chair. Mr. Constant had mentioned animals, and we get that unmistakable smell every spring. And it's hard to imagine that that isn't behind, I mean, all the dog poop and everything, isn't behind some kind of spike. And of course, the goose poop at Cuddy Park is really notable, but I mean, as far as animal poop goes, dogs not necessarily a particularly bad source?
Oh, they're a source, absolutely. We have a, well,
Stop, it's cats.
I could show you some places.
it depends on what people do with their trash bags, I guess, whether or not the cats are the source. Because there's all these little, what we call non-point sources around town where you can't just point to a single thing and say, that's a source. And we kind of put dog waste into that category because it's everywhere. We know it's a problem, but we can't we can't reduce the dog population in town now, can we? Politically.
I would try to try.
Yeah.
Well, what about the dog parks? So I've heard, several of us have a community council, university area with University Lake, and they're always saying, don't go in that lake. A lot of fecal material there, and thinking is it's connected to the dog park that's there. Is that true?
Lakes aren't a great location for dog parks.
Yeah. It's too bad. I mean, it's like the most popular place in town. Well, we're about, it's funny, we're about to put a new dog park at the headwaters of Chester Creek, although it'll be separated by some distance. But it's going to be very popular.
It will be.
Yeah.
So should we expect people to call when we go up right down the river?
If they build it right, they can.
What?
What is it you're referencing?
In the new Chauncey Muldoon Park, Phase 2, we're going to put an apple orchard and a pump track and a dog park. And this summer they got ready to build the parking lot, and there's going to be a big new dog park. And it's right at the headwaters of Chester Creek.
It's an off-leash dog park.
Yeah, so, this actually raises a really good question. Is it possible for us to work with parks and you guys to come up with the ideal design for a dog park that would, by virtue of its geography, prevent some contamination flowing into the water? It seems like there is, if it's separated, if there's some structural elements that are added the right way, we could actually create a new system that resists the flow of any kind of waste product from an open dog park into the water.
Yes, it's possible.
I do wonder if I think the folks that actually go to the dog park tend to be a little more responsible if they actually do collect their feces. You're Curtis saying no.
No.
Versus, is that not true? Versus,
Not
look,
on off-leash dog park.
It
That's
depends
what
on
goes
how
different.
wooden it is.
Right, so
There are many variables, but the number one variable that's the problem here, I'm going to harp on it a little bit, it's not your personal problem, but is that we
I
have
knew we were going to end up on animal control, you guys.
0 days of actual enforcement of animal care and control and their
I
contractors.
know. That's a
for
resource
waste.
problem, assembly.
Right.
If you want more enforcement, you have to give us
what
more
we
money.
need to do,
Assembly.
what we need to do is one day a month, each
Yeah.
of the off-leash dog parks go out for an hour and write tickets.
Yeah.
And the word would get out so hot and so fast, it would be like parking downtown. People would actually plug their meter when they started getting tickets. People would pick up their poop, but at this time, there's no reason for them to do it other than the goodness of their heart not wanting to step in poop. And for most of us, that works, but for about probably 20% of us, it doesn't. And so the only way to get them is in the pocketbook.
20% is optimistic.
Or
Well,
fear.
and if it's
No,
really wooded,
really-
my experience with dog parks is if your dog runs off into the woods,
Right.
it might go to the bathroom, or you're like, oh, good thing I went to the bathroom in the woods, so I don't have to like schlep through wetlands or whatever, pick it up right where the problem is. But if your dog poops right in front of you, most people are gonna pick it up. But
University Park had a Friends of
Yep.
program going. I think they got overwhelmed.
Friends of as
Yeah,
in
they would go in and clean up in the spring, they would
Yeah.
go in and clean up in the fall, intermittently, they would go in if it was really bad. But nothing could work as good as writing a couple $100 ticket.
That's nothing.
It's true.
This is
Nothing
University
works.
Dog Park, and as far as design goes, seems like it's not very well designed. Yeah,
Not at all.
being above
of the week. The
Not
worst
for this,
thing
but
I've
it's so
ever
popular. I
heard.
mean, it's so popular. I mean,
Yeah,
It's
yeah.
also bad
yeah,
because of
like-
the beavers that injure dogs. It's really bad.
And the
all
bicyclists,
around.
and I mean, just, and there's some trails. There's all
I like
leaf
how
and
both-
all.
All right, guys,
all-
don't mess with the park, okay?
Both our
Don't
dog
mess with the
parks
park.
Don't join the.
Are on, like,
That
on
part.
body water, or water bodies, the Connor's Bog.
They're
That's
obviously not
probably,
consulting with Bosch.
yeah.
Yeah, Baxter Bog is a really popular place to have dogs.
Well, the one by the airport, Connor's Bog, I mean,
Yeah.
insanely popular.
That's what I'm thinking.
Yeah. Okay, well, you have a little bit more. Did you want to finish up?
I can jump us back to page 7, which is what we're doing, and it's what you're talking about, and the questions you asked, you know, will people choose to use? It's worth putting a little bit of study time into figuring out what behaviors you can change with people. That would be a good place for putting some resources, because it answers a management decision for you. We do Scoop the Poop in the spring. It's more of a draw attention to this issue activity. We put the bag dispensers at all the trailheads. And then there's a lot of education that is surrounded on getting people to actually use the muffins, right? So, because
And not leave them at the trailhead.
yeah, there's that too. Yeah, now you've got plastic and food.
1,000-year protected.
And I'm wondering what the bag ban is gonna do to all of this too, but I'm digressing.
Well, no, those things
They-
though are,
I think they're free
those are
from
purchase
tax.
bags usually, either if they're the green ones that are hanging or the ones you buy.
Yeah, but I think there were
Some
people
people
that
use regular bags.
used it, which is not smart because they got all those holes. in
I
them.
know, you got a double bag.
Again, get a cat.
Got a lizard.
I would
Yeah.
add, in the
You
future,
would be a lizard person.
consider adding enforcement here. That's not on your list, and if we don't talk
I
about it,
think
it's
it's
never
right.
gonna happen.
Yeah.
And it should be part of the conversation, even if we don't do it, it's a tool we have. And it's one of the most effective tools. And I'm not talking about creating a police state where you have Jack Lou's done, right?
No, it's just, it's not, I think we've talked about it before, it's
Yeah.
not.
I run a number of
We have to
programs.
prioritize our calls based on
How much would it cost for us to put a
Yeah,
line item in and
$1
say?
$1 million, just kidding. I don't know.
No.
I'll ask them.
Maybe it is a
You're on the
question for,
record.
just
I'll
for
find
the
out.
first quarter
I'll
budget
find out.
It's like
revision.
30 hours.
Yeah.
30 hours
Yeah.
would be enough to change the culture in this town.
And we
Yeah,
could give
let's
you
do
money
it
for
in first
overtime or
quarter.
something.
Yeah, I'll find out.
Couldn't be that expensive.
We have money for square.
It's the famous last
Don't worry, we'll just pull from
Well, I
it.
mean, there are programs like our property assessment that actually make more money than they cost. I mean, if they can write tickets at the right clip.
The health department, nothing the health department does makes money to cover itself.
So I run a
Okay,
number
so,
of
yeah, let's-
programs, and I have enforcement with some of them. Construction, erosion sediment control being one, and it took a lot to get it in place, but there's a whole process for it and an appeal process, and honestly, I have never to this day written a fine because it's so much more effective to stop work than
To what? Stop what?
stop work.
Shut the site down.
I can shut the site down.
Construction numbers are about thousands of dollars a day lost immediately.
Okay, yeah.
Chrissy, can you talk a little bit about end-of-pipe sediment capture?
Sure. We have a number of ways that we try to manage for sediment for a variety of reasons, but fecal coliform is one of them. We have,
Sorry, Natasha, do we have another copy of this for John?
yeah,
And I guess I could know for the record, Mr. Wilton's either extremely
early.
late
Take note
or
of that.
early for the next meeting. I can't tell.
well, actually, he probably knows all of this, having dealt with this over the years. In the pipe, we have what we call municipal sediment basins that are around town. There's one on Minnesota and the Diamond, the off ramp there. There's there's a couple over there off of, the Seward Highway, Hartsel, between Diamond and 72nd there. There's one up, Kobuk Sud Basin up above Muldoon. There's one on C Street in Diamond. And it should be.
And so what do those do?
So they captured, so the stormwater goes into there and tries to create a quiescent area for the sediment to settle.
Mr. Dunbar?
In your professional opinion, will a stormwater utility help or hurt this problem?
It would, in the long term, help it. In the short term, it's going to confuse it, because if a stormwater utility gets in place, it's not going to create fees to solve all of the problems. It's going to create fees to solve the biggest problems, which are rotten pipes, in most people's opinion. Now, we might feel differently sitting here with this coliform table, but that's what the assembly gets to do.
Coliform table, I like it. Elevate it to a different level.
In the long term, it'll help it, because a lot of this stuff, a lot of the things I deal with that I don't have funding to do well right now would get carried along in that.
So we only have a few more minutes. We should leave time for, is anyone planning to give public comment? No, there might be a couple assembly comments, but also we should try to break like a minute or two earlier so people can go to the bathroom.
11:30.
It's at 11.
No, it's 11, 11,
Yeah.
12:30.
Oh, okay.
Anybody, yeah, never mind. Mr. Rivera.
Thank you, Madam Chair. So, I want to thank you for putting this report together. And, I think the headline is the last page, bottom line, homelessness affects water quality, but it's not about water quality. And, when I was talking with the co-chairs, I wasn't joking when I said we could do this in 10 minutes, because we just need to get straight to the headline. And so I appreciate you putting this here.
And when it says,
Up an hour a few times.
no, this has been really great.
We've been dying to talk about poop in a public forum for a year and a half.
When it says, but it's not about water quality, what does that mean?
Don't
The
make it,
statement.
don't let it become the focus of the issue. The issue is the homelessness. The water quality is a symptom.
Yeah. Definitely. We're very familiar with that.
Just the thing that I'm seeing that is causing me grave concern is that you have a number of very well-spoken people making the argument. It's almost like, I hate to put it in such old world terms, but if you look at all the propaganda posters in World War II about who is the bad person, what they're bad about, these messages that are starting to circulate about this is a public health crisis, disease. We are seeing a movement afoot to use the public health argument as a means to execute a political action. And it scares me quite a bit, actually, on a number of fronts. And so that, I think, is, don't let this be used as a tool in the campaign to villainize or vilify. That's what I take away from this.
Okay.
Well, and so if you go back to the idea of what actions are you taking, if you could get those, because you are doing stuff. The parks folks go in and hire on those homeless camps all summer long, right? All year long. And so there's things that you could list out that you are doing, and I would try to get a process built around how the municipality is addressing homelessness.
We're working on that. Mr. Whittleton? Specifically, Meg is working on that.
So I'm looking at this chart then, so are the homeless camps making a noticeable difference in fecal coliform in the water? Sorry. I
This
came
is the
late.
disadvantage of coming 55 minutes late.
Right.
We covered that exhaustively about half an hour ago.
And by the way, Ms.
You call that
Nalatel's joined us.
a hit in the 10 ring.
No,
I don't
it's
know what that
okay.
means, but I like it.
Of course they are.
And you could measure it. If you went to measure it, you could say
Well, I
it's higher.
couldn't
No.
distinguish, I can measure a peak and say some of, and I've measured peaks through history, 30 years of history. I can reasonably say that some of it is caused by the presence of fecal matter from the homeless.
But the baseline information that we got was that we have levels that are above state allowable levels of fecal coliform that come from the hillside before homelessness is even a part of it.
Not
No,
hillside.
no.
So-
No,
From
from the
park.
Not hillside. State park. From the park.
Yeah, that flow down the creek
Give
from
me your
the park.
homeless.
And the other point she made was that the levels in this last report are the same as they were 20, 30 years ago. So there was quite a bit discussed.
Yeah, sorry, Miss, if I knew that was on there, I'm glad I had to.
But it,
Could call into this one.
a target.
That's what he was
Oh,
talking
okay.
about.
But yeah, so I think, Christy, correct me if I'm wrong, but it's hard to know, you know, Forrest asked a good question about fecal coliform and what is that and why do we test for that? It doesn't test for the type of poop. So it's hard to know if it's human poop, which is more toxic, or if it's moose poop that traveled down through the hillside from the park. And so we don't have the money, state cut the funding to do testing, so we don't actually have the money to do any of that follow-up work to figure out what the impact would be. And then we have to focus on these localized areas where homeless camps are, and sometimes we do, sometimes we don't. So it's, yes, we think there's probably an impact because people are pooping, but what's the impact? Hard to say. Is that fair?
And should our efforts be focusing on testing to confirm or spending the resources, time, and money to actually address the problem,
Yeah.
which is that people are homeless and living there?
Well, just a comment on that, because we're getting what Chris does. I mean, some of these groups, they're just totally focused on this health crisis thing, and we kind of need an answer, you know, some way to respond, so this is helpful.
Okay.
And Mr. Peterson's joined us. We probably should wrap up. Mr. Dunbar, you want to finish it off for us?
Well, yeah, so I apologize if you hinted at this or answered this at the beginning of the question, but if there's fecal matter in the water, which we know that there is and has been for 30 years, do you have any, Ms. Pineda, do you have any evidence that it has caused sickness, that there is some kind of, in the last year or two, there has been any outbreak of any noticeable sickness caused by the water quality?
No, that's the report out at the beginning. Was
She
that
covered that.
we-
Yeah, I forgot
there-
that part. Thank you.
there's been no evidence. We monitor it and respond to it, and any of the diseases that are mentioned in that report that have been present in this community were from foreign travel. So there's no concerns about any diseases at this point. And I talked to a section of epidemiology this morning to confirm that nothing has changed since August that is related to anything in the water, Chesterfield water,
Okay.
or any other water.
Thank you.
So we are.
Well, the other point is that it's interesting that all of our waterways are characterized as drinking water, because I don't know of anyone in Anchorage that gets their water out of Chester Creek. I would definitely advise them not to. We have extremely high quality purified water that comes out of the Cluna or groundwater. So, right? I mean,
I don't know.
No, that would be not very good.
okay. That's the takeaway for community council. Stop drinking the creek water.
Yeah.
Or the Kool-Aid.
What's that?
Okay, with that, I think we'll adjourn. Is that okay? Thanks.